Nicole Mashburn again, and I'm going to talk to you today about anatomical regions. Hopefully at this point you have already seen a video about anatomical position, directional terms, body planes, and membranes, and so now I'm going to talk about some region terms. The first regions that we talk about are actually the two main divisions of the body. That's the axial and the appendicular. The axial skeleton, what does axis mean? An axis is something that can pivot, or you pivot around. So think about your body. I'm going to make a little stick man, okay? What do you pivot around? You basically pivot around this part of the body, which is basically your trunk, where your spinal cord, your vertebral column, your backbone is. So the axial skeleton actually includes the head, the neck, and the trunk. All of that is axial. Appendicular are the things that we would consider appendages, the things that hang off of the axial skeleton. So your limbs, your arms, and your legs are your appendicular skeleton. Now once we talk about those divisions, we then break those divisions down into smaller regions. And these are our regional terms. And we break down our regional terms based on the front or the ventral side, also known as the anterior side. We also have regional terms for the back side, the dorsal or the posterior side. This figure is from your book, and it breaks down into some large region names and then some smaller region names. And the best way, you just have to learn it. You just go through this figure and you just basically have to memorize it. Because as we go through anatomy, we are going to start using terms, these regional terms, instead of maybe terms that you are more familiar with and maybe that you grew up with. For example, this region, this large region, is called the cephalic region. And that is basically what you would have grown up calling the head. And so from now on out, we'll call that the cephalic region. You may have grown up calling this purple area, the belly. Well, that's actually the abdominal area. So, like I said, I'm going to go through a few of them, but you really just have to go through your book, go through each term and understand and get in your mind where that is on the body. Remember, when you're looking at the body, this is an anatomical position, which means the body is standing straight up with the feet pointed out and the palms pointed forward. You always use that as your reference point when you're studying anatomy. You also need to remember what's anatomical left and anatomical right. Remember, when you're looking at the model or the picture, they're reversed of what you think. I mean, you look at this and this looks like it's the left side, but actually it's not. If you were to turn yourself around and put yourself in the position of the model, this is actually the right side and this is the left side. So when you're looking at these terms, you've also got to remember the name of the term, where it is on the body, and if it's left or right. So let's just go through a few and give you that kind of give you an idea of how to do that. So when we talk about the region, so the big region of this on this model, this would be part of the axial skeleton, the head, which is then called the cephalic region when you're talking about the whole head. The forehead is the frontal region. The orbital region is around the eye. The nasal region is the nose. The oral region is the mouth. And the mental region is actually the chin. And when we get into bones, we're going to name something called the mental foramen. Foramen means hole, and so it's actually a little hole in your chin, in the bone that makes up your lower jaw, or also called your mandible. So there's a little hole there, and that's the mental foramen. So if you learn the word mental now, that'll make it easier when we talk about the bones. The arm, or the upper limb specifically, is this region, okay? You have the acromial region, which is right here, kind of what you would think of as the top of your shoulder. There's actually a little bone that's part of your scapula called the acromial process, which is where it gets its name. The brachial region, this is your upper arm. The antebrachial region is your forearm. So when you say your arm, you actually mean your brachial region, and when you say forearm, you mean, down here, your antebrachial region. You have your carpal region, which is your wrist. You have the hand, which is called the manus. We call the digits. You may have heard digits or your fingers, but we have some more specific names for the thumb, The thumb is the pollex, and your other fingers are your digits. When you look at the thoracic area, the thoracic is the big name for this part of the body, and it's broken down into the axillary, which is up under your arm, the mammary area, which is surrounds the breast area, and then the sternal area, which is what we call our breastbone. Like I said, I'm not going to go through all these. You just have to kind of go through and memorize basically how to do what these are called. But I do want you to notice there's some differences if you're on the ventral side versus the dorsal side. So I'm going to point one of those out. Your knee. If you're on the front of your body looking at the ventral side, it's called the patellar region. Let's flip the body over. Here we are. The back of the knee is called popliteal. Okay? If you're looking at the front of the lower leg, use the word crural. If you're looking at the back of the lower leg, you use the word sural. So you need to make sure you are looking and not only learning terms on the front side, but also on the back side. On the upper limb, again, we have the acromial region, the brachial region. The back of the elbow is the olecratal region. Back of the head, we had frontal for your forehead. You have occipital for the back of the head. Instead of a sternal area on the back, you have the vertebral area. You have a lumbar area. So again, just go through these and begin to become familiar with these terms, and also how you would use them. And you know, on a test, I may say the antebrachial region is what to the vertebral region. Remember those directional terms that you've learned so far? Well, you could say the antebrachial region, which is here, in the vertebral region here. The antebrachial region is lateral to the vertebral region. Or on a test, I may say the gluteal region is what to the popliteal region. The gluteal region is superior to the popliteal region. Or you might say the popliteal region is distal to the gluteal region. So I'm going to use those kind of terms in my testing versus head, foot. You know, I'm going to use these more specific region names, and so you need to know where they are and how they relate to each other. All right, some other region names that we use, and these only refer to the abdominal pelvic cavity, or that region of your body. So anything below the level of the diaphragm. So not your chest, not your heart, your lungs, or anything like that. And these are some terms that you'll see, kind of a medical terminology of where things are, because obviously the body is covered in skin and you can't see the organs inside. But you can, if you were to peel away the body, you can imagine where those organs lie, which regions they lie in. And this just allows you to know, if you say, okay, there's pain in the right hypochondriac region, you go, well, your liver is in that area, okay, or your gallbladder is in that area. You might say there's pain in the right lumbar area. You go, well, what's mostly in the right lumbar area? You've got some ascending colon. You may say there's pain in the right iliac region. Why? Because, well, what's down there? You have an appendix down there. So it allows you to know what's going on, what's underneath the surface. So you need to know the 9 regions and which organs are primarily in those regions. I'm a big vocabulary buff, and so when you're looking at these regions, if you look at what the words mean, that will kind of help you know where they are. For example, epigastric region, gastric always refers to stomach. Epi means upon, so here's the stomach, so this is the area that kind of lies upon the stomach. Hypogastric, hypo always means below, so the region below the stomach. The umbilical region, what's your umbilicus? What's your belly button, your navel? So this would be your umbilical region. You know your lumbar region is in your low back, so your left and right lumbar regions refer to that area. Your inguinal or iliac regions are here. Later on when you learn about arteries and veins, you'll learn about the inguinal arteries and inguinal veins, and they're in that region. Then you have what's called the hypochondriac, the right hypochondriac and the left hypochondriac. And hypo means below, and a lot of times when you see the word chondro, it refers to cartilage. And so these are actually areas that are below the cartilages that are associated with the ribs. So it's below the ribs, basically what that's saying. So if you wonder where the word hypochondriac comes from, If you think about when you're sick, you kind of hold yourself and kind of up under your arms, kind of near your ribs, so you're a hypochondriac, and that's kind of where that word comes from. All right, so sometimes you'll see the 4 abdominal pelvic quadrants, and actually this is a little more current. The 9 regions are a little older than the quadrants. You'll see these probably more often than you see the regions. Again, you find the umbilicus, and this is your cross point, and you just have to imagine what organs are in those regions. And so we name these the right upper quadrant, abbreviated RUQ, left upper quadrant, left lower quadrant, and right lower quadrant. And so you need to think about which organs are found in those quadrants. Again, this is only the abdominal pelvic below the level of the diaphragm. Can't really help you except just say memorize it. So, for example, if you go into the physician's office and he was to kind of feel on your right side and maybe you winced or whatever, he would say, okay, you've got pain in the RUQ, in the right upper quadrant. And then the physician would go, well, might be a liver, could be a gallbladder, that's what's there. What if you were having pain in your right lower quadrant? So on palpation or feeling it, you might wince, and the doctor would say, there's pain in the RLQ, the right lower quadrant. Could be an appendix. If you're female, you also have some things called ovaries that should be hanging out in these lower quadrants, and so you may have like a ruptured ovary or an ovarian cyst. Now, sometimes the regions actually make more sense than the quadrants. They're more specific. Think about the bladder. If I ask you, where is the bladder? Well, you could say it's somewhere between the right lower quadrant and the left lower quadrant. But how could you be more specific? You could say it's in the hypogastric region. So it's a good idea to know both because, like I said, the regions are more specific than the quadrants, but a lot of times you will see these quadrants a little more often than you see the regions. All right, short and sweet video. Watch this video and keep going. Good luck.